You have to be able to identify injury, and that can be tough because there can be a subtle difference between muscle soreness and a true injury, right? And so I agree, if your muscle is a little sore, it is good. It's good to keep it moving. I mean, and that's part of the recovery too. If you exercise a muscle, you should stretch it out. That stretching is probably going to feel a little tight, but you're right, moving through some of that tightness, moving through some of that soreness helps with that recovery. And so it can be subtle, the difference between muscle soreness and injury. I'd say a lot of times with injury, there are going to be some external factors that you see. Sometimes it's going to be obvious, right? Like you rolled your ankle and now it is incredibly swollen and purple and bruised. You probably shouldn't, push on or move through a tissue that is bruised. That type of stuff. So it can be, you have to kind of pay attention to how you feel. And typically what I would say is if you're uncertain, start with very, very low stress movements and see how it feels. So if you're saying, okay, is my knee just sore from muscles or is my knee actually injured? Maybe just do a couple of body weight squats and see how it feels. If it starts to loosen up after 2 or 3, maybe that's just some soreness. But if you're really having sharp pain, you really shouldn't be pushing through those types of things.